Good afternoon, ladies and gentlemen of the press, and welcome to those who have tuned in on our live stream. We're coming to you this afternoon from upstairs the HR training room in Braids for the socially distanced press conference. This afternoon's press conference will be focused on vaccines, and it is hosted by His Excellency the Governor Andrew Pierce and the Honorable Premier Easton Taylor Farrell. This press conference will follow the Governor's Office usual standard format, with HE and the Premier opening with brief comments, and then we open the floor to the media. The event is being live streamed, so I'd encourage the media to introduce themselves and their media house. You have the opportunity to ask 2 questions before moving on to the next person, and we will go through everyone, and if there's time remaining, we'll start the round again. So I'd like to hand over now to HE for his opening remarks. HE.
Thank you very much, Anesta, and thank you very much, ladies and gents of the press, for coming along to the press conference, and thank you very much, Honourable Premier, for joining me here today. This is an urgent appeal, colleagues. It's an urgent appeal to the media and to all members of our island community. It's about vaccination. Basically, as we start May, we find ourselves with around 900 doses of the Oxford AstraZeneca vaccine still left for us to use before they expire at the end of May. 31st of May is our deadline. And it's great that people have been coming forward and taking the vaccine in significant numbers, but we really must make sure we use these last remaining doses. It would be a travesty. It would be a stain on our island's reputation, I think, for us to have to throw away these vaccines at a time when people around the world are suffering the ravages of COVID and vaccines are in desperately short supply. So this is an appeal, and the Premier and myself are making it jointly to reinforce the importance of it, to urge all of us, please, all our fellow countrymen and women, to, if you haven't been vaccinated, please come and get vaccinated. It's simple, it's safe, it's easy, and it's the right thing to do for yourself, for your families, and for our island. I would say that I'm very grateful to 2 of our businesses on the island who have kindly come forward already in response to the information we've been putting out about this on the media in the last day or so, and have offered to provide an incentive scheme. The Premier may be able to say a little more on this as well, but essentially 2 businesses, I understand Aravin's Supermarket and Victor's Supermarket, have very kindly come forward and agreed to provide a $50 supermarket voucher as an incentive to encourage people who may be a bit hesitant to come forward and have that first dose of the vaccine. So I very much commend them for that spirit, and hope they may be joined perhaps by some others of our business compatriots. And the last point I would make is that the higher level of vaccination of the population in Montserrat really is the key to the future for us. The way this pandemic is evolving, if we can get up to 60, 70, 80% or more of our population vaccinated, it's the key to our individual safety, our collective safety, and the reopening of the island. So we really do need to move that forward. Cabinet, with the guidance of the Premier and his ministers, has been looking at exactly this and is developing what we might call an exit strategy for the island from COVID, and more to come on that in due course. But the essence of it is a calibrated sort of ratchet, where as we can increase the percentage of our population that's vaccinated, we will be able to open up more. And if people are vaccinated, they will benefit from that, because they will have to spend less time in quarantine, have less tests, and experience less hassle all round. So it's in everybody's interests. Thank you very much, colleagues. Premier, over to yourself, I think.
Thank you very much. Good afternoon, members of the media. This is indeed an urgent appeal for us as leaders of this country in terms of vaccination. This time last year, we were living in a world of uncertainties. There would seem as though there would have been no hope for us because COVID was rampant throughout the world. And as of this time, there is some glimmer of hope because the vaccine is on the scene. And when we look across the world, this is what's happening. countries where mass vaccination is taking place, the number of cases have reduced, hospitalization has also reduced, and mortality as a result of COVID has also declined. So it tells us one thing. If we are to return to some semblance of normality, clearly the answer is in the vaccine. And I've had my vaccines, I have had my both shots, and I think it's critical that all of us, and all of us here, both media and others, to help us to get the message out there. If you look at the UK, for instance, right now, the number of persons who are vaccinated have gone up significantly, some 50 million, thereabout, and the hospitalization have come down, they're now opening up. The key to opening our economy, and this is my problem, and this is where I want to get. We have had all kinds of things happening. Over the past months or so, the government have been implementing programs and projects. And the one major thing that this government have to do right now is to open the country. And this can only happen when a fairly large percentage of the population is inoculated or vaccinated. We cannot open the country unless that happens. And I urge you and urge all of us to take part in the vaccination program. It is absolutely critical. The cruise ships are asking us, when can they come back? The tourism people are asking us, when can they come? And the people in the tourism sector are suffering. And the only way we can alleviate their suffering is for us to be able to vaccinate our population and encourage and invite persons to start coming in. Until that happens, we'll be very candid in terms of opening the country. So I urge you, as all of us have responsibility, the media, and I'm not sure that we have done enough as a country, both media and individuals, to push the vaccine. I know that there is some conspiracy theory out there, and we have to counteract that. And I don't know we have done enough to counteract. So we have allowed those persons who are anti-vaccine to be very loud on the media and all about, and we're not doing our piece. I'm urging you as media personnel, get on board. And the governor and myself and my ministers and others, you are willing to push this thing forward, but we cannot do it without you. Yes, I understand that there are a couple of business places who are willing now to get on board and to provide some incentives for persons so they can take their vaccine. We're also looking in cabinet as ways and means in which we can incentivize persons who already had their vaccine. Because as far as I'm concerned, it's not fair to treat people who are vaccinated the same way that we treat people who are not vaccinated. So we're looking at that, and I believe our next order will reflect that kind of thinking, where persons who are vaccinated will be given some benefit of being vaccinated. Thank you very much.
Thank you very much, Premier. Thank you very much, Governor. We'll now turn over to the floor to the press. Can we start with CJB?
Okay, good afternoon. I'm James White from Radio Montserrat, ZJB. And Your Excellency, it's an honor to have you and, of course, the Honorable Premier to share with us in this particular setting. First of all, my question has to do with frontline workers and how critical it is for frontline workers, and in particular medical personnel, to be vaccinated. I'm throwing this out to you, Your Excellency, and I have a follow-up for that one. So first of all, how critical it is for frontline workers, and in particular those in the health service, to be vaccinated, to set the pace, basically.
Okay. Thank you very much, James. I think the short answer to that, James, is that we all in Cabinet have discussed this several times, and we are clear, there's a clear consensus that we would like all of our health workers, all of our frontline workers generally, so not just the health side, but all public servants who have a public-facing role and a duty, we would like them to be vaccinated, unless there are particular, personal health reasons. There's just a few small personal health reasons where it can be advisable not to. In every other case, we really would urge that they all be vaccinated. We understand that a majority have, and if there are a small number who haven't, we would urge them to do so. The question of whether we should make that mandatory or not is a more difficult issue for any government. Particularly the Premier rightly reminds us all of Montserrat's particular character as a small community, and sort of forcing people to do things is not the natural Montserratian way. So we have a reservation about that, but we strongly urge all frontline workers, all health workers, to please take the vaccine, lead by example in this crucial area.
Thank you very much, Your Excellency. Now the push is to have people vaccinated, and you spoke of the number of doses that we still have left. And I have an issue, and a lot of people also as well, in terms of the education process. And I'm going to ask this question candidly. Also, I could get the Premier's take on it too. Are you satisfied that enough has been done in terms of the education? There's a lot of misconception, and that in itself has provided some non-compliant behavior. And a number of people are hesitant to take the vaccine. In terms of the education process, are you satisfied that enough has been done, or enough is being done to encourage people to take the vaccine?
Thank you. No, it's a very fair question, and you've been very candid, so I'll answer it equally candidly. I think if you look at the performance of our Ministry of Health team, they've done a fantastic job. You look back to the time of last year, which the Premier was referring to in his opening remarks. Goodness me, the sort of anxiety in the island, the tension, as we had, I think, was it 11 cases, possibly 13 at its peak in April last year. The anxiety and worry was palpable. And who were the people out there doing the business, helping people in the hospitals and clinics? It was our Ministry of Health team, our experts. They were bearing all the personal risks and doing that frontline job. So absolutely hats off to them, no question. That said, I do think that the power of social media in our modern era is enormous, and it's a very powerful and can be a very effective medium, but it has some downsides. It's so easy for anyone to put on it any prejudice, any non-expert views and thoughts and information. For example, recently somebody came to me and said they were very worried about the vaccine because they saw it had been administered in Gibraltar and it had killed thousands of people. This was a terrible thing. What did I think? And of course the reality is that the vaccine has saved the lives of thousands of people in Gibraltar, literally thousands. The people in Gibraltar were so pleased with the immediate easing impact of the vaccine that they came out on the street spontaneously to thank the producers of the vaccine, to thank the British government for providing it. So it is the complete opposite of what was circulating on social media. And that is the challenge. Our experts can't be everywhere all at once. They can't be blocking every social media conversation any more than in years gone by. They could have been in the corner of every bar in a British pub, in a village. You can't do that. But there is a case for us now to be more upfront and active in putting out the very strong and powerful expert arguments for vaccination. It's really important. We need to be on the radio waves. We need to be there countering the social media false stories, and we need to be highly active. And this is one of the things that Cabinet has asked now be boosted in the coming period to really drive home this important vaccination campaign. But none of that is any implied criticism of the excellent public service colleagues who have been leading the way for us on this. It's a counsel of perfection, not a criticism.
Mr. Premier?
Yeah, I totally agree with HE. I commend the Ministry of Health staff. They have done a fantastic job in keeping us informed, in allowing us to work with the science. They have gone beyond the call of duty. But this is a separate entity. As a small businessman in another life, I believe in advertising, because they claim that if you don't advertise, people don't know what you have to sell. And I think we may have not done enough in terms of advertising. And I say we, I mean government, rather than the ministries. We may not have done enough in terms of pushing a little earlier on the vaccine, but we now have the chance to do that. And that is why we are now beefing up our ads and promotion to have more people vaccinated. Indeed, we've allowed the anti-vaccine persons to have a louder voice on the airwaves than we have. We should have gone in and counteract that, and even, but we didn't. But it's not too late. We now have a chance to do that, and I believe that we are coming up with a strong PR team, PR program to get people vaccinated, and I hope it works.
All right, thank you very much.
Honorable Premier. Dwight Sampson, DS Media. Premier, I just want to piggyback on your very last statement and ask you, has there been any conversation between yourself, your government, the communications arm of your government, and the local media in terms of developing a effective strategy for campaign for the vaccines?
I don't know. We have had discussions with the private press and media. I know that the government information unit and others have been working together to put flyers out. The health promotion unit was leading on that, and they are the experts in health education and health promotion, so we left it to them to develop that strategy. I don't know that we have had consultation with the private media, and that's probably a weakness in the system that we didn't. Of course, but you know, it meant financing as well, so we had to also look at the financing, because once we talk about the private media, then clearly I believe some would have given us pro bono, but not all. And so I don't know we have gone out there, but now is the time for us to reach out. It may involve some financing. I'm not committing government to anything, but it may just need that. But that's the case, we have to push it hard.
Okay, I wonder if I should ask a follow on that. I'll go on. Premier, can you confirm to us that all of the members of your cabinet has taken the vaccine? And if yes, why was this not used as a means of promoting the vaccine?
If you ask me if all of my cabinet, my parliamentary colleagues have taken it, I could answer that. And I will tell you no, there's one who have not taken it. I cannot speak personally for the other cabinet members, because I haven't asked them as persons, as individuals. But I know that one of my colleague ministers have not taken it, as far as I know. And I'm honest with you.
Are you in a position to disclose which one of
No,
them?
I will not do that at this point in time. We have put our photos on Facebook, so you would have known who did and who didn't.
Okay, I have a follow-on question, but I ask it hopefully in the second round, so I'll go back to Master Head.
Dwight. I believe we're going to now move on to Mr. Roach. Mr. Roach, are you with us? Yes, if you're hearing me. Okay, we can hear you. Please ask your questions.
I didn't hear the opening, I just heard it at the end of the Premier's presentation. And have there ever been any meeting with media, etc., to really talk about putting this out? Governor, my concern remains, and I did notice our chief medical officer do something about it, as to in terms of taking up the vaccine. And pardon me, people, for my preamble, but I've got to lay this out. Otherwise, it doesn't make sense when any question time comes around.
Question time is here. Please ask the question.
Yes.
Please ask the question.
Has there been anything done to help people understand that they should not be just told, go take the vaccine, but that there could be issues and that they should be able to be feeling very free and they're not being pushed to take the vaccine.
Was
Question to, please, Mr. Roach.
Pardon me?
Who are you directing that question to, please?
Anybody who can answer that.
Okay.
okay. Well, shall I go first, Premier? Yeah, thank you, Bennett. You're right to raise a question about the need for people to be careful in all the decisions they take about their health. And the Health Ministry team here have always been absolutely resolute and clear about that. I've had the vaccination, my wife has had the vaccination, my daughter has had the vaccination, most of my colleagues have had the vaccination. When you turn up to the clinic, there is a leaflet there which is thrust upon you, and you read it and you have a good look through, and it asks you if you have any particular conditions or concerns. It lists some of the conditions. There are not so many, but there are a few where it's right to be careful in taking the vaccine. And the leaflet asks you specifically to consult your doctor if you have any reservations in the light of that. That same medical professional caution has been put out by the Health Ministry team on their website, on the radio broadcasts that Nurse Brown and the CMO and others have done. So it is out there, but we're grown-ups. We need then to do the reading, check with our doctors and make a decision. Make that risk-managed decision. But the information and the careful attention has been paid to it. And we've always been clear as a government all along that this is not about, we are not in the business of making vaccination compulsory. That's fundamentally not where we want to be. We don't want to say that there's some law that everybody in Montserrat must be vaccinated. That's against the grain of this territory. But that doesn't mean that we can't and shouldn't encourage people to take it. It is the right thing, Bennett. Premier.
Yeah, we have in fact asked the CMO and staff to educate the people, and I concur that when you go to the vaccination booth, you are given this leaflet that you must read and mark off. And clearly, if you have underlying problem, we always, throughout this program, we have asked individuals to consult their physician to make sure that they are safe in taking the vaccination. So yes, we have heard other people making a lot of statements, but very little of it is confirmed. And on what we do know at this point in time, there is much more good to be had by taking the vaccine than the ill by not taking it. Yes, we have had discussions on what can happen. But if you notice, the millions of persons who have taken this vaccine, and they're safe. So I can say for certain that the vaccine is safe. I've had my 2 shots, and like AG, my entire family have taken their shots. The entire family have taken their shots, and we are still here. So I can confirm that I believe with all my heart that the vaccine is safe.
Premier. Mr. Roach, your next question.
In our next discussion, in our next session, I'll raise something very important to all of what the Premier has just said and what AG has said. Now, has there been any reports of adverse reaction to the vaccine from anyone who has taken the vaccine?
Is that a hit?
I'm sorry?
Who are you asking the question to, please?
Anyone, the Premier and the Governor are there. They're the ones who have this information. Has there been anyone who has had the vaccine report any adverse reactions from the vaccine?
No, you first.
To date in Montserrat, there's no report of any adverse effect of persons who have taken the vaccine. None, absolutely, I've not heard. And of course, there is some cases in the UK and the US very early about blood clotting.
I don't hear about the case.
But the numbers are so small in terms of the number of persons who have had the vaccine that we cannot suspend the vaccination program for those small number of cases. You just can't. COVID is too serious a situation for us to find ourselves in. The world economies are suffering, and we have to open up our economies. And if we are not going to inoculate or vaccinate, we are going to be doomed, because people are going to be unemployed, poverty is going to increase, everything is going to happen. So there's a greater good to take the vaccine than not to have it. And contrary to what might be happening, and yes, there might be a few incidences of reactions. We don't know for certain that it is the vaccine, whether there were underlying problems. But we can't deny that there might have been some reactions. But I repeat again, it's a greater good that we are looking at. And by taking the vaccine, the world is in a better position at the end of the day.
Absolutely endorse what the Premier said there, Bennett. I mean, the Premier and I and ministers in Cabinet, we are not experts in the epidemiology of this pandemic, nor in vaccination per se. But we need to get our advice from people who are absolute experts. And the WHO, PAHO, the UK Regulatory Authority, these are packed with people, professionals who spend their lives, devote their careers to analysing and studying these things. And to a man and woman, their advice is this vaccine is safe, and please take it. To a man and woman, PAHO, WHO, the UK regulatory authorities, their EU counterparts, these are real things. These are not armchair experts. These are real people, lifelong experts. We need to listen to them. Now, you raised the issue of the issue of the clotting risk was mentioned. That has been very openly and publicly noted by the health authorities. There is a very, very small indicative risk, not proven, that something in the order of 4 to 6 people may develop, out of 1 million, may develop a particular clotting complication, 4 to 6 out of 1 million. But that compares with thousands who will develop a clotting complication if they take a contraceptive pill, thousands in 1 million, thousands in 1 million. Or will compare with 100,000 who get COVID, 100,000 in 1 million will get it. So any intelligent risk balancing decision would be, of course, to take the vaccine in the face of those huge differentiated risks. Everything in life has a risk. Sitting in this training room here today has a risk. Something may fall off the ceiling. Something may happen. Somebody may step on a cable. Everything has a risk. We make a judgment about it. But the level of risk involved with the vaccine is infinitesimally low. Hence the absolutely unqualified advice from the world's experts.
We'll move on to the next question now.
Golden Discover Montserrat. Governor Pierce, last week when you spoke about the urgency to use up the vaccines, you mentioned that there were legal implications to us sharing them with other islands. Could you clarify what the implications would be and why we couldn't share?
Yeah, no, a number of people have asked that.
Us. And that's a diplomatic answer, but that I'm going on. We are at the moment we're in cabinet to encourage people to take the vaccine, is to give some incentive to persons who have taken the vaccine. And we have a phased approach to that. And you may have known that the tourism sector also have asked them to provide me with some guidelines, a roadmap. So together, I have not, the tourism sector, right, there's a advice.
Every island could have at least some quality promotions to help with the information sharing. Just a note.
Demystifying COVID itself rather than the vaccine. I think it was available here. I remember seeing it sent here. It's like a little...
It wasn't an official, it wasn't shared officially through any channels.
Right.
Or
No.
from your page, since it is a British promotion.
Right. Oh, perhaps we should have done more on that. Yeah, thank you. Yeah.
Okay. Malika Mackenzie, Alugana Express. Just a follow-up, Governor, to what Nerissa talked about the expired vaccines. You said that we've signed an agreement with the British government, and I'm assuming that all the OTs would have done that. Yes. Could we share our vaccine with them, seeing that they're in that agreement with us?
Well, that question's been asked too. We're told it's not tenable. I guess it's because each individual agreement relates to that vaccine shipment to that island and the sort of continuity of monitoring of the shipment and the passage of the shipment. So it is a question that we've asked, particularly in respect of nearby islands here, but the answer we're told by the experts in the UK government is that that's not tenable. These agreements were between individual overseas territories governments and the UK government. They're not intra-OT government.
What would be the repercussions of us just dumping those vaccines?
Well, Premier and I were talking about this earlier. Very, very bad repercussions. You look around the world and you look at all the people dying from this disease. You look at the state India's in and Brazil, nearer to home here for us. It's shocking. It's a tragedy, and they're a relatively small number of doses in the wider scheme of things, a few hundred, but that's a few hundred individuals, a few hundred lives, a few hundred families who could have been otherwise protected and saved. So, yeah, it would be a tragedy, something we really must avoid.
Coming to our last question of the afternoon, as we've gone over time a little bit. So, last question, please.
I appreciate it, Anesta. Thank you very much. Good evening, His Excellency Governor Pierce. Good afternoon, Premier. My question is two-part. First, I would like to say I respect all the work that the health workers have done. Yes. Go straight into the question. Yeah. Okay. My name is Kai Wilkinson. I am part of the team that represents the Montserrat Reporter. In respect, our own preparedness here on island for the COVID vaccination and reopening, I would like to first express that I noticed the PPE equipment the safety equipment there, the sterilization equipment at the door, so everybody has the opportunity to sterilize their hands as they come in. Now, I'm wondering if those same effects are being administered at our borders, where we are most susceptible and most likely to have entry of the COVID-19 virus.
To me,
both to you and the Premier, whoever wants to do. Obviously, it's a local issue in terms of our ports and our airport and ferry, so perhaps the Premier would like to feel that?
I have not noticed it, but I believe that part of our overall strategy in the earlies was that those hand sanitizers were placed at port of entries. I believe that they are, although I have not had an opportunity to go to the airport. I believe so, because that was part of our overall protocols when we were dealing with COVID-19.
I'll follow up that by just saying that in terms of the sterilization protocols, I'm from the Bahamas, and I was just speaking to my brother about some of the protocols they have in place there. In wide open areas, there's mass sterilization going on. We have persons that are potentially coming in. We know that they're going to be vaccinated, but if we supplement that vaccination by sterilization, is it not potentially an argument the persons could have that you guys are not doing your part to suppress, but asking a lot of persons to take this personal choice and take a vaccine where you are already stating, Governor, that you don't want to create a mandatory type situation, but Premier, you're saying that there will be a differential treatment or preferential style treatment to persons after they've taken the vaccine. And even beyond that, how do you know who has taken the vaccine so as to treat them differently?
Persons are expected to walk with some proof of vaccination. As a matter of fact, the airline industry is now asking for that. The cruise industries are saying to us they're only taking passengers who are vaccinated. So the persons who are coming in must walk with some proof that they have been fully vaccinated in order to receive that kind of incentive or benefit.
So if they're vaccinated, and are they still going to be able to bring this COVID-19 to us? Because if they're vaccinated and they're coming in and we're clean here, then where's the fault line here? Where's the tipping point? Where's my danger level?
That's the big risk you face. And this morning in Cabinet, I asked my members, what level of risk are we willing to take? Because in this whole thing, you must decide on the level of risk that you want to take. If you're going to open your borders, clearly there's an element of risk that's going to come with it. And are we willing to take that risk? If not, then we keep the borders closed. So I hear you, but people who come in, and let it be known, and we have said it, the vaccination does not prevent you from getting COVID. What it does, is that it reduces the incidences of hospitalization and mortality. So you can still be vaccinated and still have COVID, but your chance of going to the hospital and going onto a ventilator is very much reduced. So we will have to do that, because the only how you're going to encourage people to take the vaccine is not mandatory, but we want to encourage them to take it.
And how will we then identify those persons that potentially come into the country being vaccinated while still carrying COVID-19? That's it.
If our population is high, if a large percentage of our population is vaccinated, if we reach herd immunity, then we don't have no fear, because the smaller numbers that are not vaccinated could also get that immunity from us. And that's why we're talking about herd immunity. So we have no fear. And that's the importance, getting your numbers up to that 70, 75, 80% in-house. At least you can protect the rest of us.
And thank you very much, Premier. Thank you to the members of the media for the questions. As we wrap up this press conference, I'm now going to ask if there are any final thoughts before we close out.
Righto, no, thank you. Thanks, ladies and gents. I would just repeat really the key point that we made at the start, that these vaccines are here to help us. They're here to keep us safe, keep our families safe, keep our friends safe, and they're here to help us get back to something like a normality. Please let's not look that proverbial gift horse in the mouth. Please let's take them up and protect ourselves, take this opportunity.
We all are longing for some level of normality. Want to go back to sports, to parties, want to go to church without masks. This is what we want. And the only solution to this problem, to this, is for us all to be vaccinated. And let me share with you, and I'm certain you know, look at India. What's happening in India right now? We are fortunate because we have enough vaccine to take us up to about 50% of the population. India doesn't, 15%, less than 15% of the population. Other countries around us do not have it. So please help us to spread the message. Anything you think we can do, let's have a discussion. Let's move forward with it. Thank you very much.
Very much, everyone. On that final note, we've closed this press conference for this afternoon. Thank you.